Have you ever wondered how patients breathe when they can't do it themselves? Today, let's break down what a mechanical ventilator is and how it works to save lives. Mechanical ventilators and its settings are always a daunting experience for most of us. Today, in this video, we are going to see in detail about mechanical ventilation. This topic is important for healthcare workers, especially those who work in intensive care units and emergency departments. The knowledge of mechanical ventilation is critical to ensure patient safety and effective care. At the end of this video, you would be able to gain a deeper understanding about the mechanical ventilation, which fosters better communication and collaboration among healthcare team members, ultimately improving patient outcome. Come, let's dive into the topic. What is mechanical ventilation? A mechanical ventilator is a life-saving machine used to help patients breathe when they're unable to do so on their own. It pushes air, sometimes with extra oxygen, into the lungs and helps remove carbon dioxide. This is vital in surgeries, critical care, or during conditions like COVID-19, pneumonia, or respiratory failure. For whom do we use mechanical ventilators? This can be due in various conditions: respiratory illness, respiratory failure, ARDS, severe pneumonia, COPD, asthma, COVID-19, acute lung injury, pulmonary hemorrhage and respiratory arrest, neurological and other medical conditions, decreased level of consciousness, head injury or stroke, traumatic brain injury, coma, neurological diseases, spinal cord injury, cardiac arrest, drug overdose, anaphylaxis, sepsis, surgical procedures. During surgery, patients are often placed on a ventilator to ensure adequate breathing while under anesthesia. Post-surgical recovery. In some cases, patients may require ventilation for a period after surgery, especially for complex procedures. Airway compromise. Any condition that obstructs or threatens the airway, such as airway burns or massive hemoptysis, may require ventilation. Why do we use mechanical ventilators? Mechanical ventilation serves several critical functions in patient care. Oxygenation. It helps maintain adequate oxygen levels in the blood, which is essential for the functioning of vital organs. Carbon dioxide removal. It assists in the removal of carbon dioxide, preventing respiratory acidosis and other complications associated with elevated CO2 levels. Support during recovery. It provides respiratory support while the underlying condition is treated, allowing the patient's lungs to heal. Control of breathing. In some cases, mechanical ventilation can take over the entire breathing process, allowing healthcare providers to control the rate and volume of breaths delivered. Monitoring and adjustment based on the patient's needs, ensuring optimal respiratory support. Types of mechanical ventilation. The main two types of mechanical ventilation are invasive mechanical ventilation. This involves the use of an endotracheal tube or tracheostomy tube to deliver breaths directly into the lungs. Modes of invasive ventilation. Assist control ventilation, AC. This mode allows the ventilator to deliver a set number of breaths at a predetermined volume or pressure. If the patient initiates a breath, the ventilator will assist by providing the same volume or pressure. Synchronized intermittent mandatory ventilation, SIMV. This mode provides a combination of mandatory breaths and spontaneous breaths. The ventilator delivers a set number of breaths, but the patient can also breathe spontaneously between these mandatory breaths. Pressure support ventilation, PSV. In this mode, the ventilator provides support during spontaneous breaths. The patient initiates each breath, and the ventilator delivers a preset level of pressure to assist with inhalation. Non-invasive mechanical ventilation, NIV. This method uses a mask or nasal interface to deliver positive pressure ventilation without the need for intubation. Bi-level positive airway pressure, BiPAP. This mode provides two levels of pressure, a higher pressure during inhalation and a lower pressure during exhalation, making it easier for patients to breathe. Continuous positive airway pressure, CPAP. This mode delivers a constant level of pressure throughout the breathing cycle, helping to keep the airways open and improve oxygenation. Next in this video, let's touch about the key ventilator settings and their significance. Tidal volume, VT. It is the amount of air delivered to the lungs with each breath. The tidal volume with normal lung function is around 6 to 8 milliliters per kilogram of ideal body weight. But in patients with acute respiratory distress syndrome, ARDS, lower tidal volumes, 4 to 6 milliliters per kilogram, are often used to minimize ventilator-induced lung injury and prevent overdistension of alveoli. Be mindful with proper tidal volume settings as it helps to ensure adequate ventilation while reducing the risk of barotrauma and volutrauma. Respiratory rate, RR. It is the number of breaths delivered by the ventilator per minute. The normal range is 12 to 20 breaths per minute for adults, but this may vary based on the patient's condition and the desired minute ventilation. Higher respiratory rates are used in cases of severe hypoxemia or hypercapnia, while lower rates are used to allow for spontaneous breathing in patients who are being weaned from mechanical ventilation. Positive end expiratory pressure, PEEP. It helps to maintain a pressure in the airways at the end of expiration, preventing alveolar collapse. PEEP helps improve oxygenation by recruiting collapsed alveoli and increasing functional residual capacity, FRC. PEEP can enhance gas exchange and reduce shunting, especially for patients with ARDS and acute lung injury. However, excessive PEEP can lead to decreased cardiac output and barotrauma. Fraction of inspired oxygen, FiO2. It is the percentage of oxygen delivered to the patient. It ranges from 21%, room air, to 100%. The aim is to maintain adequate oxygenation with a target SpO2 of 92% or higher. High FiO2 levels can lead to oxygen toxicity, so it should be weaned to the lowest effective concentration as the patient improves. Inspiratory pressure, IP. In pressure-controlled ventilation, inspiratory pressure is the pressure delivered during the inspiratory phase of ventilation. This setting is crucial for patients with poor lung compliance, as it allows for controlled ventilation without risking high tidal volumes, as well as it helps prevent barotrauma by limiting the pressure delivered to the lungs. Inspiratory time, TI. It is the duration of the inspiratory phase of each breath. Always, we need to check and adjust inspiratory time as it can affect the flow of air into the lungs and the distribution of ventilation. Remember, longer inspiratory times may be beneficial in patients with obstructive lung disease to allow for complete lung inflation. Flow rate. Flow rate refers to the speed at which air is delivered during the inspiratory phase. Need to understand that a higher flow rate can lead to shorter inspiratory times and may be beneficial in certain situations, such as in patients with high airway resistance. Also important to know that it can also affect patient comfort and synchrony with the ventilator. Monitoring and assessment. As a nurse, it is important to monitor the patient closely, which includes vital signs and ventilator parameters. 1. Vital signs. Monitoring: heart rate, blood pressure, respiratory rate, oxygen saturation. Second, ventilator. Parameters: tidal volume, VT, respiratory rate, set. Positive end expiratory pressure, PEEP. Peak inspiratory pressure, PIP. Minute ventilation. Third, arterial blood gases, ABGs. Regularly obtain ABGs at least 4 to 6 hourly, or whenever required to assess the effectiveness of ventilation and oxygenation, as well as to guide adjustments in ventilator settings. Monitoring for complications. Be vigilant for signs of ventilator-associated pneumonia, VAP, barotrauma, or other complications related to mechanical ventilation. Regular assessment. Conduct frequent assessments and adjustments based on the patient's clinical status, response to therapy, and any changes in vital signs or ventilator parameters. It's time to take care of our patients. Hope it's easy to understand. Thank you. Friends, keep watching and supporting. If you didn't subscribe the channel, don't forget to subscribe the channel. If you like the video, press the like icon and share it to your friends. Thank you.